Gresham College presents Are Normal People Sane? By Professor Robin Murray of the Institute of Psychiatry, King's College London.
I'm really a schizophrenia researcher, so I've spent my life looking at the causes of schizophrenia and the treatment for it. So I thought it would be useful just to talk a little bit first about what is psychosis and what is madness, and probably the best illustration of that is by a self-portrait or a series of self-portraits that a chap called Brian Charnley painted. Maybe some of you have seen these before. They're on the Sane website, and he had been diagnosed as having schizophrenia, but he took his medication okay. Thank you very much. He took medication okay, and to all intents and purposes, he was entirely okay, no problems whatsoever. But he thought it would be useful to stop taking his medication and really try and illustrate how the development of how one becomes psychotic. And then once he became psychotic, he would keep painting himself because he's a very good artist, and keep notes. So this is what he did. So he stopped taking his medication in April. I mean, if you went and got on a bus and you sat next to this chap, you wouldn't think he was in any way unusual. Here he is on the 20th of April, and he says in the diary, this is him painting himself, writing in the diary, the person upstairs is reading my mind and speaking back to me in a sort of ego crucifixion. The large rabbit ear is because I'm confused and extremely sensitive to human voices like a wild animal. So hearing voices is a characteristic of schizophrenia, and I think it's quite a good illustration, this of the large ear, because most of the time we only hear the things that we focus on. Most of the time you're screening out other irrelevant, people shuffling or the noise of the computer and these sort of things. You don't pay attention to these. But when people are psychotic, all the stimuli, both what they hear and what they see, seems to sort of overload them and flood in on them, and it's very difficult to concentrate on one bit. Here he is on the 6th of May, and he says, I feel like a target for people's cruel remarks. And you can see that he's illustrated this by painting nails and darts coming at him and actually going into his eyes. And I think it's a very disturbing picture. At least I find it very disturbing. I know I could paint, I can't paint actually, but I could attempt to paint arrows coming at me. But the idea of, is it nails? I think is it nails actually going into the eyes, a sort of invasion of oneself. Here he is in the middle of May. My mind seems to be thought broadcasting very severely, and it's beyond my will to do about it. I've summed this up by painting my brain as an enormous mouth. So obviously we communicate we think something in our minds. Our motor area sends messages to the larynx, our speech area sends messages to the larynx, and we speak, and then you hear what for example, what I'm saying. But when people are psychotic, they sometimes think that their thoughts can be sent by telepathy. For example, a patient who thinks not only can other people read his thoughts, and think of it, imagine that, you go into a room and your nearest and dearest know what you're thinking. Most of the time, sometimes we don't always think kind things or well-meaning things to our nearest and dearest, let alone people we dislike. But imagine that they really knew, or people that you fancied or whatever, that they actually knew that you were, that this is transmitted. So it's very embarrassing. But sometimes people even believe that their thoughts are beamed out on the BBC. So this is what we call thought broadcasting. Here he is in May. He says, the blue is there because I feel depressed. Aha. First mobile, so other people will put theirs off. The wavy lines are just because I feel when I'm safe. A voice from the street guts me emotionally by its extrasensory perception of my condition. So he's saying that really ESP could get into his mind. He's still got the brain there as a big mouth. And you can see, really, I guess he's beginning to get depressed. He had been on what's called an antipsychotic, and he'd been on an antidepressant. And he'd stopped both of them. So he's becoming more psychotic and he's becoming more depressed. And in June, he says he's cut out his antidepressant completely. The self-portrait shows 2 decapitated eggshells, their contents devoured. The eggs, he says, have been emptied like a head stripped of its contents. It has nothing left in it, no more secrets. And when people are depressed, and we sometimes say they're nihilistic, they say they have no brain, they have no insides, that there's nothing of any worth about them. And, if any psychiatrist had seen that picture at that point, alarm bells would have rung. And sadly, he didn't see a psychiatrist and he killed himself. So he had a very clever man. He had planned it all out. He had done it in consort with a journalist, but neither of them realized that one of the things that happens when you go psychotic is you lose insight. So instead of saying to himself, I've stopped my medication, I feel as if and this has resulted in me thinking my head was nothing in my head, it was all devoured, or that my brain was like an enormous mouth. Instead of saying as if, he then began to believe that this was absolute truth and that the world would be better off without him. So sadly, he did kill himself. He was an identical twin, and his co-twin did not have schizophrenia and was very well, had no problems. Of course, his co-twin was very distressed by this, but made something good come out of it, because there was an exhibition in the National Gallery of Brian's paintings. So I think it does sort of describe what the psychotic experience is like. And as I said, I'm really a schizophrenia researcher, and that implies that there is a disease called schizophrenia. And psychiatrists have traditionally believed that out there, all of you, me, we're all sane. And then there is 1 or 2% of the population who are mad. And this is a curious sort of belief which psychiatrists have adhered to very strongly. But writers and philosophers haven't believed this. Let me give you some. So we have believed that there was a categorical distinction between those who were sane and those who were mad. But many others haven't. For example, here's Emerson saying, sanity is very rare. Every man, almost every woman, has a dash of madness. Here's Aristotle. No excellent soul is exempt from a mixture of madness. Here's Nietzsche. I like this one. Insanity in individuals is something rare, but in groups and in parties and nations and epochs, it is the rule. And it's so true that. You think of the McCarthy era and the United States, or you think of the dispute between the Muslim world and the West. It was not a rational dispute. So whole nations can, in a sense, go psychotic, as Nietzsche pointed out. And this is I like this quote very much. The statistics on insanity are that 1 out of every 4 Americans is suffering from mental illness. Think of your 3 best friends. If they're okay, then it's you. so Rita Mae Brown is a novelist, and actually was Navratilova's partner for a little while. So writers and many philosophers believed that many of us could have a bit of madness, but psychiatrists didn't believe this. And I think the reason for that was that psychiatry grew out of the asylums. This is actually what is now the Imperial War Museum, but it used to be Bethlehem, a psychiatric hospital. I guess you can probably still recognize the pillars, and nowadays the guns are here. But the asylums were established that, so here's the wall, and out here are all the sane, and every now and then somebody would be sent into the mental hospital in the hope that they would recover. But of course, in these days, they had no real treatment, so they all very often stayed there. So it became, he said, then psychiatrists, of course, are practicing in here. They're studying these people. They're not studying these people. Of course, in the 1800s, lots and lots of these mental hospitals were built in the UK and in Europe and in North America. And it was actually a very moral, in a sense, movement to try and... They built them often, actually not like the Imperial War Museum, but they built them out in the country so that they thought fresh air and good sanitation would be good for people. And you can see all these asylums. And people were sent out there. Of course, they were often sent miles and miles away from their relatives. Their relatives couldn't visit them, so even if they did begin to recover, the relatives had sort of lost touch with them. There was nowhere for them to go, so they accumulated in the asylums. And then, so there was this gradual increase of all the psychiatric beds to the 1950s. And in the 1950s, antipsychotic medication came in 1952, and also the policy became a more liberal policy to try and reintegrate the mentally ill into the general population. And as you know, the asylums have all been largely knocked down and actually turned into very expensive flats. So, you know, where what used to be a dormitory might now cost £1 million because they were very beautiful, very, very nicely made, these asylums. So now we're in the situation where most of the mentally ill are out in the community, and the scandals are not of bad treatment in the hospital, but they're of mentally ill patients, attacking people, and there's a well-known incident when a man called Jonathan Zito was stabbed on a railway train by somebody with psychosis. So we have even though we don't lock up people with the mentally ill, the newspapers still tend to regard them as lunatics or as people quite different from us, not just here but in the United States. So really the way that psychiatrists have gone about, if somebody is referred to a psychiatrist by the GP, the question of the psychiatrist is this man psychotic? Is he schizophrenic? I use these words almost interchangeably. Psychosis, schizophrenia is really the severe end of psychosis. And psychotic people have hallucinations and they have delusions, and I'll come back to that. So a psychiatrist will... his job or her job is really to say this individual is not psychotic and doesn't require treatment, or this lady is psychotic and required treatment. So this is what psychiatrists have traditionally done. It's a sort of all or none thing that say this is a disease, either you have it or you don't have it. So we have this sort of notion that there are these mad people, and these mad people they have bizarre ideas. They can't think logically, they can't plan for the future. And then the rest of us are sane, and we can do these things. Actually, sadly, this may be one of the last times I can show this slide, because in a year or so, people will be saying, who is this man? We don't know. So what there is a sort of system. It's called the DSM. So people like me, we come together in little groups, and we say, well, the criteria for schizophrenia are X, Y, and Z. And then there's there's various different types of it, and they produce books which made a lot of money for the psychiatric publishers and so on. So we diagnose schizophrenia essentially on the basis of two things: a hallucination, which is a perception in the absence of a stimulus. It's not like an illusion. In an illusion, there is a perception there. You see the sand shimmering, and you think it's an oasis, but there is sand, and the air is shimmering, I guess, a bit because of the heat. But you actually see something there, which you misinterpret. Whereas a hallucination is where you actually create a perception where there is none, and you can see ghosts, you can see visions, but in psychosis people usually hear voices which may plague them, say terrible things to them. You're a shit, why don't you kill yourself? The world would be better off without you. Or sometimes have conversations. There he is, he's getting up. Why is he so lazy? Why is he so slow? He never washes. And then another voice which may say, no, he's doing his best. He's not been well. He's trying hard. And voices that may argue. And then the other way that we diagnose psychosis or madness is on the basis of delusions. And that a delusion is a fixed, false and unshakable idea in which people invest a great deal of emotion. The CIA are persecuting me. My parents are poisoning me. The doctors are poisoning me. There's or very bizarre things. The CIA have put a chip in my brain, or somebody's planted a reptile in my intestines. When people have very bizarre delusions or very strange hallucinations, it's not at all difficult to make a diagnosis. But as the problem comes when it's less clear. And traditionally, psychiatrists have thought that schizophrenia was like a brain disease. And so we spend a lot of time doing brain scans and showing that people with schizophrenia have slightly less grey matter, and a bit of the brain called the hippocampus is about 5% smaller. It's not gross like an Alzheimer's disease. But we tend to think that these changes are partly developmental, and the disorder runs in families to some extent. Like heart disease or diabetes, you don't inherit it, bang, but you inherit a predisposition. And also, if something nasty happens to your brain as you're developing, you're more likely to develop something like schizophrenia. So hypoxia at birth or prematurity, these sort of factors. But recently we've been more interested in questions of social factors. So we, for example, have looked at different places in the country. We've looked at how common schizophrenia is in Bristol and in Nottingham and South East London. And so let me ask you, do you think that the incidence of schizophrenia would be the same in Bristol and Nottingham and in South East London? Or do you think in Bristol they're all mad down there? Or Nottingham is so dull that nothing... Excuse me. So what would you vote for? Okay. I couldn't hear what you were saying. So anyway, schizophrenia is 3 times more common in South London than it is in Nottingham and Bristol. And Nottingham and Bristol is actually higher than in the countryside. So the bigger the city, the greater the frequency of schizophrenia. And does anybody live in South London? Yes. So where would you think the highest incidence would be? Actually, I only have data on inner London. I'll show you. This is actually inner London. So the Thames would be round here, going round here. I think this is Battersea and Wandsworth. This is Clapham, and this is Brixton, and we're going over to Lewisham here. So these dark areas are the areas where the incidence is high, and in some of these, it's 9 times commoner in some areas than in other areas. So what do you think these white areas with the low incidence, what would be characteristic about them? Yes. So there is a relationship between schizophrenia and poverty. And one question it's puzzled researchers a lot. Is it that you start off in all classes, and then as you get ill, you tumble down and you end up living in a bedsit in Peckham? Or is it that actually being brought up in Peckham gives you a higher incidence? And it is actually, there's probably a bit of both, but being brought up in an inner city increases your risk of schizophrenia. And I can tell you that there is one factor that predicts the incidence of schizophrenia most accurately, and that is the proportion of the population who vote in a general election. So it's not that mad people vote Labour or mad people vote Conservative, but if you live in an area where there is a sense of community and people care and there is to some extent some cohesiveness, then there are lower incidences of schizophrenia. If you live in a disorganized area where nobody votes and nobody knows their neighbors and there's no what people would call social capital, then this pushes up the incidence of schizophrenia. Also, ethnicity. Migrants always have higher incidence of schizophrenia. So, for example, if we take British whites as the sort of base population, non-British whites, so Europeans, Americans, Australians coming in London, have an incidence 2.5 times that of the local white population. South Asians, who are Indians and Pakistanis mainly, 1.4 times. Africans, essentially 6 times, and African Caribbeans 9 times. So if you're an African Caribbean living in the UK, they are 9 times more likely to get a diagnosis of schizophrenia. There's been a lot of argument as to whether this was white psychiatrists misdiagnosing black people's culture. But I think it's now dismissed that idea, because if you're black and you're born in Brixton, and you or even if you're a third generation, so you really know very little about Caribbean culture, you're still 9 times more likely to be diagnosed as schizophrenia. And we've had black psychiatrists from Africa or the Caribbean come, and they still diagnose also our black patients the same proportion as schizophrenic. So it does seem that there is something about being a migrant. And I don't think it's very hard to understand that. I mean, I would give the example of, would you buy a second-hand car in Greece? Or, I don't mean especially, or Morocco, or... I mean, it's bad enough trying to buy a second-hand car anyway, because you wonder, are they out to trick you or do you or whatever? But if you buy such a car in a place where you're unfamiliar with the norms, and when you don't know whether you don't quite understand the social interactions. Or again, let me give you another example. If you go on your holidays to Rome, and at Rome airport, you stupidly hire a taxi. I mean, how many minutes is it before you begin to think, is this person going around in circles or taking a long way in order to make money out of it? When you're in an alien culture, or when you're a culture from which you feel distanced, you're more likely to become a little bit paranoid. And indeed, it's a protective factor. So one of the reasons is this sort of alienation from mainstream culture. And I guess one question is the black community more alienated? If you're born into a one-parent family in Brixton, your teachers don't seem to be helpful to you, you leave school, you don't get a job, the police keep picking you up, can you almost be taught to be paranoid that the system is against you? So there is this question. Another factor which we know increases the risk and has caused some controversy recently has been drugs, and in particular cannabis. And this is just a cartoon of a chap. You can see here he is with his joint saying, lots of bad things happened to me, lots of bad things. I couldn't think straight, all going round in my head. They're watching me at the precinct, whispering and watching. It's quite a clever cartoon, this, I think, because you go past one of these television shops, sometimes they do actually video you. I had to make sure they didn't follow me home. Trevor McDonald started sending me warnings about them. It's clear what's on your mind. I had a transparent head. They could read my mind. I was shit scared. I becoming increasingly confused, looking where I knew that there had to be a device where they were videoing me. Where was the device? And sometimes people take their rooms apart or their electricity or their television apart, looking. Actually, even occasionally, people actually, if they believe they have a chip implanted in a bit of their anatomy, they'll try and dig it out. So eventually he comes to hospital, and here's the nurse, David, can you hear me? I'm Nurse Jess, and this is Dr. Bone, and here's the psychiatrist. Put simply, Mr. Jones, schizophreniform, pre-psychoticus, symptomaticus, andy-pandy, ging-gang-gully-gully. And you can see he has no idea what the psychiatrist is talking about. So we've increasingly seen a lot of people using both amphetamine and cocaine and cannabis who've gone psychotic. So you can think of psychosis as resulting from some biological factors, some hereditary factors, drug abuse, and some types of social adversity. But we've still been thinking that all of if you think of heart disease, if you talk to a cardiologist, they don't say there is one cause of heart disease. They say you inherit some susceptibility, your cholesterol gets high, you smoke, you don't take any exercise, you get obese, your blood pressure goes up. All of these factors are risk factors, and it's the same for schizophrenia. You inherit susceptibility. You may have some developmental hypoxia that slightly damages your neuronal connections as you're getting older. You may take drugs. You may be abused by your parents. You may migrate. All of these factors contribute. But it still has been on the basis that normal people don't have any psychosis and mad people have all the psychosis, which is different than the way we think about anxiety and depression. I'm sure all of you, when you hear that somebody's off work because they're depressed, or somebody has killed themselves because they've suicided, or, I mean, the poor man who was in the newspaper yesterday who was found in Victoria Station after being depressed, you can empathize with that and say, I've been a bit depressed too, these various things. After these various things happened to me, I got depressed. Or when I was having my exams, when I lost my job, I was so anxious. And you can imagine if it was just a bit more, you would get an anxiety neurosis or a depressive illness and have to see a psychiatrist. But traditionally we've thought that believing, hearing voices, or believing that the world was against you, or people were trying to poison you, or these psychotic ideas, we've thought that normal people didn't have these. But more recently, we've started asking normal people about these sort of experiences, and do they have psychotic symptoms? And in fact, one of the biggest studies was done in 2000 by a chap called Jim Van Os in Holland, of 7,000 individuals. And they asked about, do you think people are against you? Do you think people interfere with your brain? Do you ever hear voices? And these classic symptoms of psychosis. And essentially what they found was, as you would expect, 1.5% of people fitted the diagnosis of schizophrenia, but about 4% had delusions and hallucinations that psychiatrists thought really needed treatment, even though they weren't diagnosed. And then 17% of the Dutch population had a psychotic or a psychotic-like symptom. And this was the first sort of notion that 17% of all of us might have might have a psychotic symptom. And then there was the question, well, maybe these are just silly little symptoms. You know that you know how people get worked up on the neighbours come to blows and occasionally kill each other over the demarcation of their hedge, and that one person thinks the other person is spending all his time moving the hedge in the night, or people that live in flats think that the person above is deliberately walking backwards and forwards in order to disturb them in the night. We didn't really know, do any of these symptoms have anything to do with serious schizophrenia? And the reasoning is really like, why are some people obese? Is it that 95% of the population are quite slim, and then 5% are grossly obese? Not any longer, certainly, no. Is there a gradation? And so the question is it that sort of minor levels of the general level of weight and eating habits has a bearing on the frequency of a gross obesity? Yes, of course, we now know that. The question is, does the general level of paranoia and psychosis in the population have a bearing on the number of schizophrenic people we have? And so Van Os did an interesting study where he thought to himself, we know that, as I said, from the rural to the most urban, you get more schizophrenia. So you would expect to get the greenness schizophrenia. So you would expect it to go like that. So he measured in rural areas, in not-so-rurals, in moderate cities, and big cities in Holland. And it could be that schizophrenia is going up, but the rate of minor psychotic symptoms in the general population is the same. So these minor psychotic symptoms could have nothing to do with schizophrenia. But in fact, what he found was that the rate of schizophrenia went up, but so did the rate of paranoid and psychotic symptoms. So the people in the cities had more minor psychotic symptoms than the people in the country. Actually, I don't need to show that. And we did a similar study of 8,500 British people, screened them all for psychosis, and we looked to see, we know the things that cause schizophrenia or increase the risk of schizophrenia, but we looked to see, do these people who have, maybe they just are paranoid about their boss, or they have a strange idea that someone from down the road, they hear their voice. Are these people that have these sort of experiences, do they have the same socio-demographic characteristics as people with schizophrenia? And essentially that's what we found. We said that if you have one of these minor paranoid or hallucinatory experience in the general population, you're more likely to have a lower IQ, which we know is associated with schizophrenia. Poorer education, we know is associated with schizophrenia. Living in cities is associated with schizophrenia. Being dependent on cannabis, we know is associated with schizophrenia. Being victimized or having adverse life events. Obviously, why do some people have an adverse life event and become depressed? Well, type of life events which are associated with schizophrenia are much more intrusive ones, like being beaten up or having people burgle your house. So things where you're almost right to be paranoid increase your risk of schizophrenia. And neurotic symptoms. So Louise Johns, who did this work, said that minor psychotic symptoms in the general population are related to the same variables as schizophrenia. Psychosis is at one extreme of a distribution of psychotic symptoms. So a lot of evidence has come out this way, saying that it's not that people with schizophrenia are like men from Mars and the rest of us are here. It is that there's a gradation from people who are not at all psychotic, have never had any eccentric or odd ideas, through people who are a bit paranoid, to people you know, and I'm sure you all know people like this, are so touchy. At the very first possibility, they'll develop strange ideas that people are against them or something is happening to them because some individual is against them. So we need to think of, I think, schizophrenia like many medical disorders, which we think of as part of a continuum, like blood pressure. We don't think that the vast majority of us have normal blood pressure, then a few unfortunates of sky-high malignant blood pressure. There is a gradation, or obesity, or diabetes, or anemia. It's not that most of us have got hemoglobins of 15 and a few people have hemoglobins of 7. There is a gradation. So for blood pressure, for example, the physicians, they say, well, there is this gradation, but when your diastolic blood pressure gets to 90 milligrams of mercury, we will treat it. The idea of a dimension makes us think about causal factors operating in the general population, like obesity. No use, it's ridiculous just to go around trying to get very fat people to diet and putting bands around their stomach. So, what we really need to do is the rest of us all try and take more exercise and not eat so much. And I'm sure you're all familiar with reading the newspaper, and there's somebody who has done a violent act, and one psychiatrist stands up in court and says, this person is definitely schizophrenic, absolutely, clearly schizophrenic, therefore he should not be responsible for his actions. And the other psychiatrist stands up and says, this person is clearly not schizophrenic. And so it's ridiculous, but it's not. It's as if one physician was standing up and saying, this person is definitely grossly hypertensive, and the other physician is saying this person has an absolutely normal blood pressure, when the difference is really between 89 and 91. So it would be more sensible for psychiatrists to have this sort of dimensional view rather than this categorical view. So if we have such a view, we all have to think that we are somewhere on this continuum. So let me think. Let me ask you. Do you ever feel that others are against you? Do you ever believe that others are influencing your mind? Do you believe that other people talk about you? Can you communicate with animals? Or if I make it more pointed, do you ever feel that your boss is against you? I 2 years ago became the editor of a medical journal. I can assure you that one of the normal reactions of academic researchers, when their paper is rejected, is, why have you done this to me? Why did you get my worst enemy to referee this? People are provoked into paranoia very easily by this form of sort of rejection. Do you ever believe that others are influencing your mind? Well, what is advertising about? Our beliefs are shaped by TV advertising. Do you believe that other people talk about it? Do your friends and neighbours gossip about you? Of course they do. We say, where have they gone? Oh, they're going up to London again. Oh, what are they up to today? And you say, you go back and say, I went to a lecture. No. If you have a pet, can you tell what it's thinking? Is that sane? You think it is? Yeah. I mean, it's clear we can sort of, you know your pet's normal physiology and how it holds itself, and you know when it wants to go for a walk and that sort of thing. I'll give you a strange example. One of my nurses in my unit was on the radio with a prominent psychiatrist, and they were talking about schizophrenia. And afterwards, the psychiatrist discovered that the nurse was besotted with dogs. And he said, well, I love dogs too. Can you tell what your dog is thinking? And she said, well, yes, sort of. And I know roughly what he's thinking. He said, no, but can you really read his mind? And can he read your mind? And she said, well, sort of thing. He said, I can communicate with animals. And he said, I'll give you an example. Psychiatrists sometimes have to go out into the community and what we call section somebody and say somebody is maybe going to kill themselves or threatening harm to somebody else. We have to go out. Sometimes we have to go with the police and take them into hospital. Anyway, according to my nurse, the psychiatrist then said, well, give you an example. I went out to see this man, and the police wanted me to section. As I got there, outside the door, there was this little cat. And this cat looked at me and said, if you section my master, what will become of me? Who will feed me? And he said, I thought about this, and I thought this was a very sensible point that the cat put to me. So he arranged for the man to be treated at home. Now, it probably was a good thing for the man to be treated at home, and it may well have been good for the cat as well, and so on. But it's difficult to know. Is that within the normal? I mean, it sounds strange, but this is I know this man. He's a very respectable, straightforward man. You would not in any way think he had any psychotic symptoms. But just in this one way, it's clearly unusual, at least. So let me come back to this question. A hallucination is something you hear in the absence of a stimulus. So is the Pope, I don't know, probably, I actually don't know, does the Pope hear the voice of God? Or is somebody who hears the voice of God, are they hallucinated? Well, usually we sort of psychiatrists get out of this by saying we would only diagnose hallucination if it is out of the normal cultural context. So we would say if other people have the same experiences or believe the same thing, we would not regard it as pathological. And what about delusions, a fixed, false, unshakable idea? So, for example, if I were to announce to you that last week I heard the voice of God who said, Robin, you should go and migrate to Ethiopia, and that you should smoke lots and lots of cannabis and worship the Emperor Haile Selassie, would I be psychotic? I would, because not many aging Scottish professors, I mean, very rarely it might be possible, but if I was a 40-year-old Rastafarian, then you might well say that this is within the normal. I mean, it's becoming less common for people to have a Rastafarian belief, I think, but certainly 10 or 15 years ago, it was not that such views were not uncommon. So we have to think of the context. So what about people that believe in aliens? If you were to go to work on Monday and somebody said, how did you get on at the weekend? Oh, it was really amazing, actually. And Friday night, this little spaceship landed and little green men came out and took me off to another planet and did all sorts of strange things to me and brought me back on Sunday night. I mean, how would your friends and colleagues react, they would think this was well outside the norm. But there are lots and lots of people who believe this. Is the belief that the Pope is the Antichrist, is that a delusion? It isn't a delusion, because a lot of people in Northern Ireland believe it. Certainly, I don't know whether he still believes it, but this is a quote from Ian Paisley to the old Pope, the previous Pope in the 1980s. I denounce you, Antichrist. I refuse you as the enemy and Antichrist with all your false doctrines. So this is a very this would be a culturally normal belief. So you would not get somebody diagnosed as having schizophrenia on that basis, although I don't think there is any evidence to support it. What about this? There are weapons of mass destruction in Iraq. Was that a delusion? It was a fixed belief. It was a false belief. It was unshakable. It was held with great conviction. It wasn't a delusion because it was shared by a large number of people. Not by the millions of people that walked through London, but it's certainly in the high political classes. It was shared by a lot of people. If somebody said to you today there are weapons of mass destruction in Iraq, would it be a delusion? It might well be, because you would have great difficulty in finding else who believed it. So, to some extent, a delusion is diagnosed when you cannot persuade other people of your belief. What about Mr. Al Fayed? It is reported, and I have to be very careful here, I'm saying he's reported in the press to believe that Princess Diana and his son Dodi were murdered as a result of a conspiracy masterminded by the Duke of Edinburgh. Is this belief within normality or not? You think it is?
Well, he can contextualize it.
So there is no evidence for it, and we would accept this. And this is something that he has maintained with great. He's maintained it for a long time. It's unshakable. It's as far as we can tell, it's false. I don't think many other people share it, but it's sort of understandable, isn't it? That here is a man whose son was on the verge, he thinks, of a very important relationship with a royal princess, and they're both wiped out. So it's such a traumatic experience, and also there's a question as to who is responsible for this death. You can understand the psychological mechanisms which may have contributed to Mr. Al Fayed having a belief which is quite different than that held by the general population. So we wouldn't. He would, if he was to see a psychiatrist would not think he had schizophrenia. But I think it also illustrates the fact that if you are poor and you have such a belief, and you go to the Social Security and have a row, or it's not called the Social Security, and you go to the job centre and you have a row with the person across the counter because you have some strange belief, well, they will send for the police. You will have a row with the police, you'll fight with the police, and you'll be carted off to a psychiatric hospital maintaining your belief. But if you have a lot of money, then you can sustain quite strange beliefs. If you're the Prime Minister, you can actually go to war on the basis of a false belief. So the idea that bizarre beliefs are not common in normal people, I think is incorrect. Now you may think, well, these illustrations I'm giving you don't affect me. But what about horoscopes? So this is Mystic Meg. How many people? I shan't ask you how many, but some people will have read Mystic Meg today. I don't know if you're read it. It's Mystic Meg is the horoscope person in the Sun, and so some of you may actually have read the Aquarius. I'm Aquarius, so this is what she says about me today. The mind-sharpening planet Mercury shines directly on you, so the time is right to step outside your normal comfort zone. So this is pretty good. I have never come and give a public lecture in central London before. But single? At first, you just notice that you think alike and finish each other's sentences, but there is love potential. Well, there you go. Do you want somebody who's going to finish your sentences? I'm not sure. But so how many millions of people read these horoscopes? Do they believe them? So why do the newspapers print them if people don't believe in them? I think people partly believe them. Or, excuse me, there is a range. Some people, the Richard Dawkins of the world, they won't believe any of this. But there are people, there is again a gradation to people who will actually believe it. So let me conclude at this point by saying that I think we used to think that if you take the general population, that all of us here were sane, entirely sane, and there were just a few people with schizophrenia here. Then we began to think, well, maybe sometimes some relatives or people are a bit paranoid, they might be part of a spectrum. And then now we think that quite a considerable proportion of the population will have minor psychotic ideas, just like some people will be somewhere on the distribution to diabetes or to obesity or to heart disease. But we shouldn't sort of think that we shouldn't sort of think that people with schizophrenia are like an alien race, are quite different from the rest of us. Most of us have the capacity to develop psychotic ideas and have hallucination, delusions, given the right environmental circumstances. Anyway, I will stop at that point, and I will be very happy to answer any questions you have. Thank you. And I think there are microphones somewhere. Microphone. Oh, two. Okay. So why don't you start with the microphone?
All right, thank you very much for a thought-provoking and interesting lecture. But my question is, I always understood that schizophrenia involved multiple personalities, or at least split personalities, but you haven't really touched upon that. Could you comment, please?
And it's a very common belief, and schizophrenia has nothing to do with... I'm sure, you're not the only person here. Half the people here will probably believe this too. Schizophrenia... The term was invented in 1909 to describe the fragmentation of the personality. And normally you can think of the brain or the mind as a sort of orchestra, and the woodwind and the trombones and the percussion should all be in harmony. But in schizophrenia, you get a disintegration. So the cognition or the frontal functions get separated from the auditory processing of speech. What is commonly thought a split personality is multiple personality disorder or hysteria. So people who have one or more personalities, as in the Three Faces of Eve, things like that, we would not think of them as being schizophrenic. And antipsychotic medication and the sort of CBT treatments that we do for psychosis would make them worse. So it's a very good question to ask, because I'm sure lots of people, and there is this, because the term schizophrenia is a very unfortunate one. Firstly, because the movies sort of in the 50s portrayed a muddled up schizophrenia and multiple personality, and also because you ask people, what is schizophrenia? Schizophrenia, to most people, it means a madman with an axe. And so it's a very, people don't say to me, oh, Dr. Murray, thank you for telling me I've got schizophrenia. I was really puzzled about what used to be. Now I've got schizophrenia, everything is clear. People regard it as an insult. So we would be much better off with another term. But unfortunately, we can't agree on what it should be. But thank you for your question. The chap next. Yeah.
Thank you. You talked about people who have been dislocated from their sort of cultural norms being people who are sort of susceptible or have a higher susceptibility. Yes. Clearly, incidents like war and those sorts of things tend to dislocate large numbers of people, so it would provide a good statistical sample. Is there evidence from those sorts of things, or say Cambodia, Kampuchea, or something like that, in terms of those populations?
Well, one of the problems, you have to have quite a sophisticated society to measure incidence. So, nobody knows how common schizophrenia or psychosis is in Cambodia or Vietnam. And even, if you take the Second World War, there was so much dislocation that to count the number of people in any city with any accuracy and to know the proportion that would go psychotic. So we really don't have an answer to that. The only thing I would say is that if you have an enemy, that's actually quite good for your mental health. You might have thought that in Northern Ireland, with all the troubles, that there would be more psychiatric disturbance. There was actually less. If you can hate the Catholics or the Germans or the Muslims, it engenders a sense of cohesion, or vice versa. So we don't have, we really don't have any evidence that these types of calamities. It's more a chronic. It's more like a chronic alienation and suspicion of the majority population if you are a minority. And for example, one curious thing is that if you're in an ethnic minority in South London, you might think you would strive very hard to better yourself, and you might go and live in Bromley with middle-class whites. In fact, the incidence of psychosis is higher in the people that do that than the people who stay in Brixton. You're better to stick around with the social support that you get from your own kind. So it's an odd thing that, and I don't know if any. I think to myself, my only occasion I've been in an all-black town was in Soweto. And sort of walking, as the one white person in Soweto, and everybody's sort of looking at you. It's a bit like, being black and walking down my street in Bromley. So I think we haven't proved this yet, but I think there is this question not just of discrimination, but of perceived difference and distrust of the society. Thank you.
Just thinking of what you said about assessment and the DSM, and touching on your experience as a clinician, I think Lang said in The Politics of the Family in '69, if we deny the official definition of public events, we are regarded as mad. As a general indicator for somebody involved in the treatment of schizophrenia, does that still apply? And secondly, or does that apply as a general indicator? And secondly, does the theorising of R.D. Lang have any currency for practitioners today?
Yeah, I went into psychiatry partly because of R.D. Lang. He came from Glasgow, so of course he was a great hero of mine. So R.D. Lang was actually one of the curious things. If you ask medical students nowadays who R.D. Lang is, they have no idea. He was a guru in the 60s and 70s, but disappeared. He was never accepted by the psychiatric establishment. And, of course, the one bad consequences of R.D. Lang's theorising was that parents were scapegoated. So bad enough having a child who developed schizophrenia, but then to be told by a social worker or a psychiatrist that you caused it by the way you brought up the child. So this R.D. Lang had interesting, it had theories about family behaviour inducing psychosis, and we had a sort of revulsion from that to schizophrenia as an organic disease. And then it's only recently we've gone back to consider that social factors can contribute. So I think, curiously enough, Lang said that psychosis is much more understandable. So most psychiatrists of my generation were trained that madness is not understandable, and that's what makes it different from anxiety and depression, because you cannot understand why somebody would believe that there was a reptile in the intestines. It just seems mad. But Lang said if you think hard enough, you can find a reason. I'll give you an example. I have a lady who not any longer, but believed, one, that her husband was having an affair, and two, that the social workers were going to take away her children. She was absolutely convinced that these things would happen. She actually had a diagnosis of schizophrenia, and she was on an antipsychotic medication which diminished her sexual drive. So she had no interest in any sexual relationship with her husband. So naturally she began thinking that he would be having a relationship, and if you're in and out of psychiatric hospital numerous times, what do the social workers do with your children? They take them away. So in a sense it was sort of natural. She actually heard voices of people saying he's having an affair and they'll take away your children. So you could sort of understand how she had got to that point of view. So I think Lang's views that it's really what I'm saying, that people with psychosis are at the extreme end of a continuum, and we should try and understand. And the whole basis of psychological therapy for schizophrenia is attempting to. It's not analytical as Langian was. It's more behaviour therapy. So I think in these terms, I think people are curiously, as Lang has become less popular in the general populations, psychiatrists have begun reading him again. Should we go over here? The lady in the front.
Has there been any work, or does anyone think it's useful, the age at which people start taking cannabis, say the young mind or the teenager, does that have an increased likelihood of producing a schizophrenia?
There are several studies. I think the first thing today is that psychosis is a young person's illness. Relatively few people would go psychotic at my age. No, if I start having strange beliefs of acting in a bizarre way, it might be because I had psychotic depression, it might be because I was dementing. It would be very unlikely to be schizophrenia. So schizophrenia, psychosis is a young person's illness, particularly young male's illness. And so, of course, also, it's young people who use cannabis. So these two things tend to get muddled up. Our experiences, and some of the papers suggest that if you start really before you're 15, so the archetypal person I would see is somebody who maybe started at 12 or 13 or 14 taking daily joints and smoked constantly till they were 18 or 20. I think that does seem to be particularly damaging. You don't know whether that is because the brain is still maturing, and if you throw a lot of cannabis, and endocannabinoids are important in the brain, if you really mess up that system as it's still developing, whether you might do irreparable harm, or alternatively, it may be you start abusing cannabis, the teachers find out, you get slung out of school, you go into the skids, you take other drugs, and you become more dependent. So we can't exactly see why, but the suspicion is that the younger you start, the more risky it is. Of course, also people, of course, of an older age use cannabis in moderation for multiple sclerosis or pain, much lower doses. And although it's an occasional complication, it's much rarer. But I think this is because older people are less susceptible to schizophrenia-provoking drugs. Psychosis, the final common pathway is having too much dopamine in your brain. So anything that gives you too much dopamine makes you more likely to be psychotic. Anything that blocks it makes psychosis better, like all the drugs for psychosis are dopamine blockers. People have most dopamine when they're young. This is why the young are impulsive, why they get their very react, and our reward is very important. As one gets a little bit older, you get less dopamine. If you have too little, you get Parkinson's disease. But you also get less. Things are a little bit duller, I think, as one gets older. The chap behind, yeah.
You made a very convincing case that there's a spectrum of psychosis and a fairly uninterrupted spectrum, but there's one situation which you did touch on where you're faced with 100% yes, 100% no, and that is the question of responsibility for a criminal action. Yes. What's your view on that?
Yes, I think it is. I mean, lawyers like things to be cut and dried, yes or no, don't they? So, and we psychiatrists like, we'd like to have a more sophisticated point of view, but I think it would be very difficult to go into a court and say, well, this man scores very highly on positive psychotic signs. He only scores 3 on negative psychotic signs, and he scores such and such on disorganization scale. And the lawyers or the judge is going to sort of look at you, and it's too complicated, isn't it? So I don't know how we resolve this. The other thing I should say is that we've been contemplating dimensional diagnosis in the next version of the DSM, which is the sort of Bible, the diagnostic Bible. And there has been a strong case that we should move to dimensional. How psychotic is this person? How anxious are they? How depressed are they? And the meeting I was at, the man from the American Psychiatric Association said, you can produce all the psychiatric evidence and scientific evidence in the world to support dimensions, but I assure you that an insurance company will not pay for a dimensional score. They pay for diagnoses. So, of course, psychiatrists in a private practice sense, they want to be able to say this is a disease. Of course, it's not a disease in the sense that we know it as a physical disease, but these diagnoses are sort of simplistic categorizations, which at present I can't think of a way that one could incorporate these into legal practice or into into private medical practice, that you would get paid so much for a percentage score on a dimension. So I think scientific advance tends to go before people sort of work out the practicalities, and I don't think we've even thought about these questions properly.
For all information, please go to our website at www.gresham.ac.uk.